Hi, it's Dr. Buford. We're picking up on the video. We're already in the subacromial space. I'm going to show you this large rotator cuff tear. We've already looked inside the joint, but we had to change out our microphones. That's why the video is starting up a little bit late. But as you can see here, we're using an instrument called a burr to thin down this bone that makes up the roof of the shoulder called the acromion. So the way we're looking from the back of your shoulder. The burr here is coming in from the side, and this cannula is coming in the front. Okay. So as we get through there, now we're going to change positions and put the scope where the burr is. Okay, so here's this large rotator cuff tear. This is the posterior aspect of it in the back on the left side of the screen. We're just using our shaver just to improve our vision here for a minute. Okay, so there we are, the posterior aspect. This is the anterior aspect. Your biceps tenodesis is going to happen up there. We had to cut the biceps inside the joint because it was torn. Our plan is to reattach it out here in the subacromial space. We've got another cannula in the front that we need to push it into the space here. So here's our spinal needle. This gives us a good idea of where our suture anchor placement is going to be. You can see posterior here, this tear is actually a bit delaminated. There's a deep layer that we're going to incorporate into the repair. We're going to place our first suture anchor down right about here. So we'll go ahead and take a scalpel and make a little nick in the skin. Go ahead. And then we'll go ahead and place a guide in that little nick. Coming in, I'm just checking our position here. It looks like I need to place this first anchor down right about here. There's the articular surface. We come back 5 to 7 millimeters if we can. And that looks like a pretty good spot. Here is the anchor down in the bone, and then there's our first suture going out the anterior cannula. Now we're going to take a suture hook through this blue cannula to pass our first stitch. So we use this. It's loaded with a black wire called the super shuttle. We're going to basically place a stitch something like that in that direction. But first we're going to take a grasper and make sure that I'm getting all of the layers of the cuff here in this repair. So I want to get underneath. I want to reach that deep layer here. And if there's any way to reduce it, then I will. Otherwise, if that's where it's supposed to be, then we'll leave it alone. See how that, can maybe get that reduced a little bit, come back on top. Okay. Okay, there we are through. That looks good. We'll go ahead and retrieve the relay here. We'll hold that anterior cannula. Pause. Okay, so we've got our first suture pair passed. It's just coming through the posterior aspect of this tear. And what we do a lot of times in these big tears is we'll tie this first suture posteriorly because it gives us a good anchor point. Our post goes on the rotator cuff side right there. And then we're going to go ahead and tie a knot outside your shoulder and then slide that down to secure the tendon back to the bone here. So if you look on the video in just a minute, you'll see that knot come sliding down. There it is right there, and as you pull tight, you can see how that's going to snug that down and help us with our repair. Pause. Okay, so we've got two sutures tied. We're going to put in a second anchor for sure, so we'll open that up. Now we're going to pass the third suture from this first anchor. You can see how those two have helped us quite a bit in the back. We'll show you some more in just a minute. Here's the first part of the repair. We've got 3 sutures tied. 1, 2, 3. Okay. Very happy with the way that looks there. We've still got a hole here to fix, so we're not done, but we've got the first half of it done pretty much. So now we'll go ahead and get to work on the second half. Here's our second anchor in the bone. Let me just reorient you. There's the first one. Here's the second one. Now we're going to go ahead and pass these 3 sutures. So we've got 6 sutures passed and tied here. We're all the way up to the rotator interval where the biceps comes through right there. And we're going to place another suture anchor right there to secure the biceps. So we're going to go off on the video for just a minute. Okay, so we're all done here. We're looking towards the back. There's our repair in the back. And as we rotate towards the front, we can see that we've got a pop lock anchor down to secure the anterior portion of the cuff and the biceps tendon. And that all looks real good. So we're going to finish up here and get you back to the recovery room shortly. Grasper, please. Good luck to you now. Bye-bye. A better final look here at what we've done. Sutures in the back. You can rotate your arm. You can see that everything moves very solidly. You've made some holes in the bone. And that's our pop lock in the front, so that looks good. So we're going to finish up here and get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye. Let me see the shape of one.